Welcome to Cryos Clinic's first webinar. My name is Mia. I am a fertility nurse here at Cryos Clinic, and I will be your host today to this webinar. I've been looking forward to speaking with some of you, maybe after this webinar, and just to introduce you to the options that you can have for fertility treatment here in Denmark. Today we will go through fertility treatment with donor X at Cryos Clinic in Denmark. And I will be going through some slides here. And if you have any questions during this webinar, please note them down, because in the end we will have 10 to 15 minutes Q&A session where I will take as many questions and answer them as good as possible. And if I do not get your question and I don't answer it, please don't hesitate to contact us after this webinar and ask the same questions again. Thank you. All right, well, let's get started. Today's agenda is that I will go through the egg donor screening here at Cryos Clinic. I will go through the donor profiles that we offer. I will go through the treatment that we offer at Cryos Clinic Aarhus, and also the ones that we offer in Cryos Clinic Copenhagen just shortly. And we will also go through the prices. First, our egg donors has to be between the age of 18 to 34 years old. They have to be healthy, psychological and physical. Most are required to have some level of higher education. It's not a must, but we want them to as much as possible. It is a must that they meet the physical requirements such as BMI, AMH, and AFC. It's a very thorough and long process to become an egg donor at Cryos Clinic. We have very high demands to our egg donors, and only around 4 donor candidates are accepted as egg donors. And this is something unique to Cryos Clinic compared to other clinics in Denmark. We are more thorough. We go through much more genetic testing, and therefore we consider ourselves to have the better product. I have just selected one of our egg donors here to tell us about their motivation to become an egg donor at Cryos Clinic. And in this example, she says, I'm a donor because I've seen so many different perspectives of the egg donation process. I worked with an individual who struggled to create a family. Later in life, I met someone who was the product of an egg donation. I thought it was a wonderful, beautiful thing that I wanted to be a part of. And this is something many of our donors say. Many of them are just here to help others, and we really protect our donors as well. They have to be motivated to go through this process. It's a long screening process, as I mentioned before, and I will go through the process here. Because at Cryos Clinic, you start out to do an online application on our Cryos Clinic website or our Cryos International website, where you send in an online application. We then send a medical and family history questionnaire where they have to go through 3 generations of their family tree, and we have to know about all the diseases that they have. And if they do not know, they are not able to become donors. They have to be able to get the information about the 3 generations in order for us to make sure that they are not in a higher risk of having a genetic disease or anything genetic. Once they have filled out the medical and family history questionnaire, we have an initial medical screening. We go through, as healthcare professionals at Cryos Clinic, we go through the questionnaires. We go through if they have something that we would consider being a higher risk of anything, and then they are refuse to be a donor. But of course, we are very happy to get all the applications possible, but it's very important to us that they are no higher risk than the average population. Besides the medical team going through the questionnaires, we also have a psychologist who has a conversation with all of our donors. She will make a psychological assessment of the donor. It will be a talk about how and why they become donors and how and why they want to. Also, the type of donor profile that they choose. So this psychologist will see if they are healthy mentally, and also if they are ready to take the responsibility it is to be, for example, an ID release donor. After the psychological assessment by our psychologist, the clinical examination, the ultrasound, and the screening for diseases will be initiated, and this will be done by the medical staff in the Cryos Clinic. We will look at the donor's whole body, and we will see if there are any signs on the body on diseases, and we will do the genetic testing, and we will also do testing for infectious diseases. Besides this, we will go through risk behavior with all of our donors, that they have to use protection with if they are having sex, or if they don't have any other risk behaviors as taking any kind of medications, or if they have tattoos or anything that could have an impact on the donations that they have to give. And out of this whole process, only 4% of the donor candidates are accepted. Here you can see it's called Summary of Records. This is a document that is under Documents under each profile on our website. You will be able to see the information about the donor, but also what they have been tested for, the blood group, and you can see all the infectious diseases on the top, and you will be able to see what genetic testing we have done on each donor in the bottom. This is much more comprehensive than any other clinic in Denmark. Then we come to the donor types and the donor profiles. Compared to UK, in Denmark, you will be able to use also the non-ID release donors that we have. We have ID release donors, we have non-ID release donors, and both of them have either basic profiles or extended profiles. The basic profiles is race and ethnicity, eye and hair color, height and weight, blood type, education or profession at the time of donation. But in the extended profile, the same information is as in the basic profiles, but also we have a detailed Q&A with donor describing interest, experiences, family background, and more. There are photos of them as a child. They have an emotion intelligence profile as well, a small voice recording, and a handwritten message to future parents or children. And they will also have a staff impression. This is an impression that we as a medical staff will fill out once we meet the donor, and the first impression that we have of her we will put down in writing, and we will try to explain how this individual might be the perfect fit for you. But these are the two different kinds of informations that you can have on the donors. And regarding the non-ID release and ID release is that if you choose an ID release donor as is a legal requirement in the UK, it means that the donor at the age of, the donor child at the age of 18 can contact Cryos and get the information that we have on the donor, so that they have something that they can use. And also, if they choose a non-ID release donor, they are not able to contact Cryos and get any information. So these are the two different kinds of release. Here's an example for a basic profile. They have a number and they have just the basic information about the donor. And if you go to the extended profile as shown here, you will be able to see that the general information and characteristics is here, the Q&A with the donor's family tree, and the handwritten note and the voice recording and everything. I would recommend you to, after this webinar or the next couple of days, go to Cryos Clinic website and go through the donors that we have and see the different kind of donors that we also have. We have more than in the Cryos Clinic and Cryos International, we have more than 75% 75 different ethnicities, and we have donors on the Cryos Clinic website that has a little box that says upon request, and this is the Danish donors that we have not collected the eggs from yet. So they will be contacted if they were to be chosen on the website, and then we will collect the eggs, and then we will make the embryos to the treatment for the recipient. Some of our donors also have photos of them as an adult. And I asked Marie from France to tell me why she chose the donor of this specific kind that has adult photos available. And she says that the photos of the donors as an adult give you a more concrete and real impression. It brought me a personal feeling, which I think is also important in the particular choice. Of course, this is not important for everyone, but it is an option. So if you were to have this personal feeling, and if you want to get the opportunity to see them as an adult, you should use your filters on the website and ask for the ones that you are able to see as an adult. I will go through shortly what we offer at Cryos Clinic. We offer ICI treatment with donor sperm, IUI treatment with donor sperm, IVF treatment with donor sperm, reciprocal IVF, which is also called ROPA. We have, and this is also with donor sperm, and we have donor egg treatment. And donor egg treatment would be at Cryos Clinic in Aarhus, where you buy the donor egg. You will also get the transfer at Cryos Clinic as well. If you choose to do the embryo creation treatment, we can do the embryo creation for you. You can select the donor of your choosing, and we can get the sperm of, for example, your husband, and we will make the embryos, but you will choose to where we could ship it to, for example, a local clinic in another country. And then last, we have double donation treatment is for those who both need eggs and sperm from Cryos, and then we will create the embryos at our clinic, and we will do the transfer with us as well. And please, again, just to remind you, if you have any question, please just note them down and we will go through them in the end if we have the time. Who can buy egg donation treatment at Cryos Clinic? This could be women who has entered menopause earlier than expected, or women who has low quality eggs, or has shown lack of response to stimulation in previous fertility treatments. So they have had more attempts before without results. If she had her ovaries removed or has undergone a course of chemotherapy or radiotherapy that has harmed the ovaries. According to Danish law, Cryos Clinic can only treat women up to their 46th birthday. So if you are older than that, we are not able to help you at Cryos Clinic Denmark, unfortunately. So if you at any point go to Cryos Clinic website and you look at the donors that we have available in there, you can filter by your preferences and check your settings. So you can go in and say what kind of ethnicity you want or wish for, or a specific kind of eye color or hair color you like, and you can choose the egg donor. You can add the number of blastocysts that you would like to buy in the basket. You can buy one, you can buy two, you can buy three, and we only transfer, due to Danish legislation, we only transfer one embryo at each transfer. So if you would like more tries, we recommend you to buy more than one blastocyst. Of course, when you buy the treatment, if you were to buy two blastocyst of this donor, and then we will go through your medical history, of course, and we will say, okay, it makes more sense for you to buy three because of your age, or that will heighten your chances of a pregnancy, and we will have a conversation about that. We will try as much as possible to give you a realistic chance of becoming pregnant. And this has many factors under each chances, of course. Then you would add the sperm donor also in the basket, or if you choose your husband's sperms, this will be a choosing on the website as well. And then you go to the checkout. So we will talk a little about the prices that we have. The embryo creation treatment at Cryos Clinic is embryo development at Cryos Clinic with eggs and a husband's sperm, for example. So this will be the eggs that we make, and we will make the embryo development with this. And the starting price with this will be 3,959 euros. The donor egg treatment will be also IVF, ICSI, depending on the quality of the sperm of, for example, the husband. And we will make the embryo development, and you will choose in the donor egg treatment to get the embryo transfer at Cryos Clinic. So the embryo creation treatment is that we only make the embryo and then we can ship it to a country of your choosing or your clinic of your choosing. Or you can choose to get the transfer at Cryos Clinic and the embryo creation at Cryos Clinic as well. And this will be 5,309 euros. And lastly, the double donation treatment is the embryo development at Cryos Clinic, the Cryos donor sperm, and the embryo transfer at Cryos Clinic as well. So the whole process will be made in Cryos Clinic in Aarhus, and this is the starting price of 5,834 euros. When we say starting price, it means that it depends on which donor you choose. So if you choose a basic non-ID release donor, they are less expensive than if you choose an ID release extended profile with adult photos. So there's this is only for the sperm donors with the adult photos, but this is also a significant change of the pricing. You will be able to, when you look online, to see each and any one of the donors and what their price is. So you can put them in the basket and do your own just an example of what you would like, and then you can see the total price before you go to checkout. The price that we list up here is for a single embryo. If you choose multiple embryos, you will receive a minimum of 20% on each additional embryo. So it will be the price would be higher, but it would not be double for 2 embryos. The additional cost to consider with this treatment, it would be the medication for the patient undergoing treatment. This will not be included. So if you have any hormone stimulation before the transfer of the egg, this is not included in the price. This is something that you will be able to get in your home country. In the UK, we have many partners that can help us get the prescription, and they will contact you and they will give you both the invoice and the medication to your doorstep. Normally, this process is smooth and is very good for our UK customers and patients. They really like our cooperative partners in this situation. Additional cost to consider besides the medication is handling of the partner sperm. So if you're choosing the donor egg treatment with your partner sperm, the partner will be able to either go to a local clinic in the UK and get it shipped to our clinic, or your partner can come to our Cryos International Sperm Bank just beside the clinic here in Aarhus, and they can make a storage with their sperm, and they can after that be sent to our clinic for the embryo creation. This is not included in the price. And if you choose the embryo creation treatment, the shipment of the embryo is not included. And this is if the embryo transfer would be in your local clinic, there will be a cost, an additional cost, and this is depending on where you need it shipped to, of course. But this is something, if you want to know the exact price, please contact our customer care team in Cryos International, and they will be happy to help you with the approximately price on the transfer. Yes, let's go further. At Cryos Clinic, we also support donor-conceived children and their families. So if you are in the process of, you are maybe just considering buying egg donation or just any other treatment at Cryos, we have an online community to support any thoughts, or if you have any consideration during the process. We have a Facebook group called Family Dreams, where both patients and customers of Cryos International and Cryos Clinic can help each other out, and you can get off maybe some frustration in the process of your chest, and someone to support you on the way. Of course, we at the clinic will also be this support system for you when you are in treatment with us. So if you have any concerns during your treatment here with us, we are more than happy to help you through this. We do care about you, and we do care about the treatment that you are going through. We know that this process is tough. We are doing this webinars, for example. We also do info meetings where we physically meet up and we offer information about our clinic. And of course, you can be a subscriber of our newsletter as well. And of course, both the Cryos International and Cryos Clinic will be here to do personal counseling with you through your fertility treatment, also before and after. You are also always welcome to contact us. And when the happy thing happens and you become pregnant, and with the birth, we have online publications with, for example, the midwife's guide before, during, and after pregnancy, where you can go through what we recommend you take as supplements, and also what you might consider being a new mom and everything else. And of course, the parenthood, the website section with guides for parents. And of course, we have our children's book made by Cryos. You can see a little picture of it on the right here. It is Our Miracle, or if you are single, it's My Miracle. And it's a small book where we have designed as a children's book, so that we go in the height of the children, and we have a little story about how they become them, and how much mom and dad, or just mom or mom or mom, struggled to get exactly you. And it's a beautiful little story, and you can buy them online, but if you get pregnant with Cryos Clinic, you will get them for free. And Cryos International is working on to contact with Cryos donor in the future. So if you were to use a donor with ID release profile, when you get pregnant and when you give birth to your child, you will get a donor child certificate from Cryos International and our clinic if it's an egg donor, and you will have free counseling for donor conceived children before contacting the donor. So if they have any consideration or they need support to go contact the donor, we will be able to help you in the future, and your future child as well. As I said before, we are here to help you. We can assist you in English and Danish in Cryos Clinic. And if you have any other language that you speak, which does not include this, you are not able to get treatment in Denmark with our clinic unless you get a translator with the initial consultation and with all your visits to our clinic. If you have a translator, then it is possible. We want to make sure that everything is smooth during the process, that the patient will understand the risk that they are going through, and that they also know what the chances are, and so that nothing is new to anyone when the results come or anything else. Nothing should be lost in translation. The communication is very important, both for us and for the patient as well. So if you are interested, of course, please book a free consultation on our webpage. Me or my colleagues at the medical staff in Cryos Clinic would be happy to have an initial consultation with you, where we can go through your options for fertility treatment with eggs with Cryos Clinic. If you want to chat or only have some information, just want some information, you can also just send us an email. You can call us. We can also just take a conversation on the phone. And if we do not answer the phone, please just send the email and ask for a phone call, and then we will call you as soon as we can. But I don't have more right now. I hope that this webinar, besides the Q&A that we are going to start in a minute, is at the webinar has been insightful for you, and you feel more inspired to contact us, or if you might consider going to our webpage and see our selection of egg donors. Yes, but let's go to the Q&A. I will have them up here. Please don't hesitate just to, if you have any questions regarding anything that I said today, or if you have questions about anything that I didn't say. Okay, we have one here. It's, let me see here. Someone asked here if it is possible to do the embryo transfer at a clinic at our Cryos Clinic in Copenhagen. And unfortunately, this is not possible. We only have the ecto treatments in Denmark, in Aarhus, the second largest city in Denmark. We only do ICI treatments at our clinic in Copenhagen, unfortunately. And we have one more here who asked what, sorry, what is the timeline with egg donors treatments? And of course, this is very individual. If you choose a donor who is upon request on our website, this means that we have to, if you choose a donor, we will have to ask the donor, are you ready in this cycle to do your donation? And of course, it depends on the donor's life right now when she starts treatment. We want to respect that the donor have a life beside being a donor at Cryos. So it will be an individual timeline for this one. But if you choose one of our donors who has another ethnicity, maybe the ones that we have in our Cypriotic clinic, where we also have eggs, which is already frozen. The process is much faster because then we already have the eggs, so we can make the embryos for you. Yes. And I have one here who asks, is it possible to develop the embryo in your clinic after 46 years old if transfer is made in another country that allows it? And unfortunately, this is not possible because you have to be under 46 when we start the treatment. Sorry. So if you are 45 and we start treatment, we do the embryos, we can ship them to another country after, but we cannot initiate and start the treatment after the age of 46, unfortunately. And another one asked here, is the first consultation in the clinic free of charge, and is it online? And we offer both online and through Teams. We would love to see you in person, but we know that traveling from the UK to Denmark would be comprehensive and expensive. So we will have a Teams meeting, if not physically, and it is free. The first consultation is free, so please just book online, enter your personal information, and we will contact you and set up a meeting where we can go through your options for egg donation treatment at Cryos Clinic. And I have one here asks, how many eggs do you advise to buy? are 4 eggs enough? And our egg donation treatment, you are not able to choose eggs. So if you were to choose blastocyst, 4 eggs would be suitable in most cases, but it would be an individual assessment each time. So I will recommend you to have an initial consult where we can go through your medical history, and then we can do the recommendation. It's not possible to in Cryos Clinic to buy the eggs. It's only possible to buy the treatment with the embryo creation. Yes, and I can see here, is there a limit for BMI? If I were to choose Denmark and Cryos Clinic as my treatment clinic. And we do not have a specific limit for BMI, but as I mentioned before, it is an individual assessment each time. We know that there are higher risk of many diseases if you have a higher BMI than what we consider normal. And but of course, it depends on you. It depends on how old you are. It depends on, of course, your height compared to your weight and your body structure and your lifestyle as well. So there's another limit, but if we were to see you to be more overweight than normal, we would recommend, of course, that someone lost some pounds before, or if the BMI would be as close to more normal as possible. But it is an individual assessment. This is not a limit as itself. And I have one more here asking, how often can treatment be repeated at your clinic, and how long has to be between it? This is also an individual assessment each time, but normally there can be a new treatment in each cycle. It depends on the outcome. It depends on the process of the outcome as well. So if you were to get pregnant but had a miscarriage, or if anything else happened to the stimulation or anything, it is an individual assessment. But if everything looked good, but we didn't succeed in a pregnancy, we will be able to start a new treatment in the next cycle. Yes. And there is one here asking if a UK citizen can choose a non-ID release donor in Denmark. And I mentioned this before in the webinar that it is possible in Denmark to choose either a non-ID release or ID release. It is, due to Danish legislation, up to you which one you choose. Yes. And I think we have one more here. Is it possible to do the embryo transfer at another clinic also in the UK? And this is possible, yes. You have to ask the customer care team to get the prices on the transfer to UK from Denmark once we have created the embryo for you. Yes. And unfortunately, we are not able to get more questions right now. We have been through them, and we have been through our time. I would just like to say thank you for today. Thank you for participating, and I hope that you thought that this webinar was insightful, that you got the information that you hope to get. And if not, please don't hesitate to contact us after this webinar. We would love to have a chat with you, and of course have an initial consult with you so that we can go through all your options here at Cryos Clinic. So thank you for today. I hope you have a great evening, and I hope to talk to some of you after this webinar in the next following days. Thank you. Bye.